I think all of us need to understand what it means first and foremost. What does kidney health mean? The kidneys are a really important organ in our bodies. They take care of all of the waste products, all of the toxins. They filter our blood and they remove all of the things that shouldn't be there. And when they work well, it's great because, again, we're at our best. But when they aren't working, that's a big problem. That is a huge problem. And when they're not working, we have a term for that. We call it chronic kidney disease. And so how does one know whether or not their kidneys are working well or not? It's an interesting piece because at the end of the day, there are not a lot of symptoms early on. And so it's important for all of us to know this phrase that we use across, this space is know your numbers. In other words, know the numbers that are associated with what good kidney health means. And we can talk about that in a little more detail going forward. So some of the misconceptions that I think we hear about kidney disease, chronic kidney disease, kidney health, really is related to sort of the why. And it's also the timing around it. It's also how do I know whether or not I have chronic kidney disease? I think one of the big, sort of issues is that we know that in certain cases, kidney disease issues run in the family. In other words, they have a genetic, sort of history with them. In other words, my mom might have had this, or my father might have had this, or my aunt might have had it. And in a lot of cases, we weren't informed about that. We just knew they had kidney disease. We didn't know what that meant. And nobody really told us that it was really important to make sure that we knew our numbers, that we knew what our kidney function was like. And so I think one of the misconceptions too is that, it's chronic kidney disease. Certainly I'll have symptoms and there will be a way for me to know that I'm okay or not. And in fact, as we said earlier, there are very little symptoms associated with chronic kidney disease, especially in the earlier stages. And why is that important? It's just like anything else. The earlier you know about it, the more likely you are able to actually have treatments and things that actually make it better. In other words, slow the progression. I mean, we have about 37 million people in the U.S. who have chronic kidney disease, and about 800,000 of them actually progress to full-stage kidney failure. And it's a disproportionate amount of Blacks, 4-fold higher rates of Blacks, 2.5-fold higher rates of Hispanics than whites develop kidney failure. Part of the reason for that is that we don't know our numbers. We don't know soon enough that we have a problem. And so by the time we know, oftentimes it's too late. I think it's a combination of things. I mean, the most common cause for chronic kidney disease is diabetes and hypertension. Again, those are two diseases that often don't come with a lot of symptoms. And so we know maybe we've got a family history of diabetes or high blood pressure, but we don't always do or are able to actually access healthcare systems that would allow us to actually get the real diagnosis and get treatment. And so I think it's a combination of things. It's certainly the social determinants of health, where you work, if you have access to medical care, where you live. We know you can go, 10 miles one way or the other and be in a different neighborhood, which then associates itself with different mortality and morbidity risk. So I think it, just like a number of diseases, it follows those social determinants of health. And so that's why it's so important from an educational standpoint for all of us to know that there's so many diseases, first and foremost, that have a disproportionately higher rate in Blacks. When we think about the ones that are most common, whether it's kidney disease or heart disease, then I think we have to make sure that we, first and foremost, are educated about them. So we know what questions we have to ask of our healthcare providers or, in church, wherever we are. We need to be able to educate ourselves in a way that we are informed enough to at least ask the right questions. If you don't advocate for yourself, then who else will do it for you? And if you know you're not able to advocate for yourself, make sure you bring somebody with you that can advocate for you. But it is absolutely okay to ask those questions. Getting a test result that you can't interpret, that you know nothing about, doesn't help you at all. To fully benefit from actually knowing what those test results mean, you have to ask those questions. And then you have to ask, okay, now what does that mean? As a physician and as a patient myself, I have definitely challenged my healthcare provider, and I mean it in a nice way, but I have asked questions that I thought were relevant, to the situation. And I think if I know sort of a lot of the questions to ask, but a lot of us, when you think about the average patient, doesn't know that. But that you have questions, and write them down beforehand. Try to think about it. Ask other folks who might be able to help you. But there should be always a shared decision making between you and your healthcare provider, and that can't be if you don't ask those questions. So you should always do that.